Hi, this is Stefan Maar. I'm a specialist for trauma therapy in Germany, and today I have my patient Bill here. Bill is a veteran who has served in the military of the United States as infantry soldier in Iraq. And today we're talking about what can I do other than medication like lorazepam, like medical cannabis or the self-medication, alcohol or cigarettes. What other, let's call it, healthy possibilities are there? And thank you for being here, Bill, and sharing your experience with our audience. So tell me, what other things can be done to, with the necessary amount of patience that you need, but what's your experience on other possibilities?
I think it is a combination of things, but I think it's a lot of times, I think therapy is the first most important thing, because that kind of gives you tools to take apart your problems, right?
Yeah. Being able to talk openly.
Just openly and figuring out, just figuring things out, right? And sometimes, it's not even, that you're getting the solution to the problem, right? Sometimes the answer to the problem is just being able to speak about it out loud.
Yeah.
And a lot of times, you've helped a lot with a lot of things. Sometimes I come up with, as I'm speaking it out loud, I kind of get the answer, because when it bounces around in your head, it doesn't necessarily work the way as if you're talking it out.
Yeah.
So I think
very important.
I think therapy is important. I think, vitamins, just regular vitamins. I don't know if health-wise it helps me out a lot.
What kind of vitamins would you suggest?
I take, vitamin D with K2, magnesium. Those are important. Vitamin D.
The combination, I think, is really important to be absorbed, right?
Yeah, exactly.
Vitamin D, K2, and magnesium.
Yep. I take the A through Z, the C, D, C, B, and D stuff, the normal stuff you buy at the store. Nothing that's crazy expensive or anything special.
But a vitamin B complex, I think.
I take, vitamin B. I take
it's not a bad thing.
Ginkgo biloba. I take stuff for swelling, curcumin, keratin for the skin. Also, I've got a handful of vitamins I take every day.
Yeah.
And that helps out, I think. Maybe it's in my head, but it helps me out. And then physical activity. Doing something.
Well, we did laboratory tests, and maybe for the audience, it seems to be that vitamin D deficiency seems to be often connected with when, for instance, war-related PTSD patients are suffering from a vitamin D, a low level of vitamin D. There seems to be a relation to it, which possibly is not proven yet, but when we do regular laboratory works, then we see, especially in the beginning, there was a pretty low level of vitamin D.
Right. Well, and then for me, it was one of those things when you kind of see the results.
Yeah.
A lot of times you think you're healthy and everything else. Yeah. But then when you see the stuff down there and you see there's a lot of things that are lacking that are kind of an easy fix, right? Yeah. So, take a couple, take a handful of vitamins, and it makes you feel better. Yeah. And then physical fitness, right?
And you mentioned massage. Physical fitness, I think, very big, often underestimated. And one of the symptoms seems to be avoiding, training, avoiding physical exercise. Right. Super important, I think. Also, maybe to get some aggression and stress out through that door, quote unquote. And maybe one last thing for today, maybe we'll do an extra show on that one, is massage. Whereas I think the idea of Thai massage, that is 90 minutes, 120 minutes, maybe just a short statement on that one.
Look, it's the therapy and the massage on a weekly basis. It's kind of like, doing your checks on your weapons before you go out. It's cleaning your weapons. It's making sure that everything lubes, that everything's going to fire correctly. It's just that self-care, right? So, all those things in combination, it's not going to solve everything, but it's going to for me at least, it puts me in a better way. I feel it when I don't work out. I feel it when I miss therapy because of work or whatever reasons.
Yeah.
And that therapy in combination with, you know, a Thai massage or whatever else that goes with that. I mean, it's self-care, right? So
we will do an extra show on that one soon. Thank you for watching again, and all those veterans out there who feel they may suffer or do suffer from war-related PTSD, don't hesitate to call, and there is a lot we can do. Stop suffering. Thanks for watching. See you next time.